Can you share a bit about what your mental health experience has been like as a Black person?
I'll be sharing some thoughts with you for Mental Health Awareness Month. When I reflect on my own mental health, I recognize that my experiences have been uniquely shaped by various components of my identity. So, for me, as a Black, Christian, Caribbean woman who migrated to the United States during pre adolescence, there were often times where I felt like an other. I was quite sensitive to not quite fitting in because I was an immigrant. My mental wellness was also very much tied to being raised in a rather strict religious family from a British colonized island. They had very specific ways of thinking and behaving and expected me to do the same. These behaviors and beliefs were sometimes at odds with being the typical American. I also faced challenges when, unlike early life experiences, I was one of few Black people or persons in an environment. Sometimes I was the only, and sometimes I was the first to accomplish some academic marker. While I was working to integrate these multiple identities, I have been required to ward off stereotypical notions of who I am or who I should be, where I should live, or even what career I should pursue. I can recall an incident where an advisor tried to dissuade me from pursuing clinical psychology because admission rates for those programs were extremely selective. Instead, that advisor tried to steer me to a more stereotypical woman-dominated helping profession. I've experienced the joy of being the first person of color to attain a graduate degree from my program, but later felt demoralized by having to prove that I indeed had earned my doctorate degree by furnishing a physical copy of my degree to a family after I had evaluated their child, and they were displeased with my findings. My mental health has even been challenged in situations in which I've been verbally attacked by a supervisor while doing a therapeutic intervention, so much so that my client felt the need to rescue me. I could offer so many more examples, but in essence, attending to my mental health has entailed a fight to discover and uncover who God created me to be, irrespective of what others think of me, because I am Black, female, Caribbean, immigrant, educated, a psychologist.
I want to talk about the questions on Black male mental health in an integrated way. I'd like to integrate them together and answer them in three moves. The first is discovery. Growing up in my community, we did not discuss or talk about mental health in public conversations, and more so, African American male mental health was an unspoken or taboo subject. We never unpacked what or why someone would be labeled crazy or touched, or why you didn't talk to that cousin who slept in the back of grandmama's house or your auntie's house. We didn't engage in mental health conversations. We didn't even halfway engage with those folks that we felt had mental health challenges. I had no community or language or expertise to unpack what Black maleness, manhood or masculinity, or how mental health affects Black maleness, manhood or masculinity. So black manhood and masculinity denied us the vulnerability to discuss mental health, and therefore we suffered in silence. And in small ways, your mental health or wellness was affirmed by the head nod or the dap or keep your head up or the question, you good? And so part of my African American experience is to learn and to come to grips with the institutional factors that dehumanize us. My mental health was something that I had to go on a self-discovery journey to understand the institutional factors that played a part in my mental health or my mental well-being. Those things that affected me or dehumanized me, the systems that I believe inadequately prepared me to deal with these institutional factors emotionally, psychologically, how to deal with this hostile environment. So as a black male, at times I felt inadequate or ill-prepared to deal with the society around me and my mental wellness as I engaged in the things that happened around me, again in society, such as the Rodney King murder, as Walter Scott, as Breonna Taylor, as George Floyd, and all of the different killings that have happened over the years, the Alton Sterling, the Philando Castile. How do I engage emotionally in these things that impact me, not personally, as in my immediate circumstances, but it still impacts me through the group trauma or the trauma that is engaged in as African Americans. We have this group trauma as we see these successive things. So every part of our African American experience is to learn and understand and come to grips with these institutional factors. So I embarked on a journey of discovery. And as I talked about my mental health and wellness, I had to search out ways to affirm my mental wellness, to affirm my humanization and liberation. And with that, I pulled concepts from the emancipatory educator Paulo Freire and his concepts of humanization and conscientization. And so humanization is, as Freire talked about it, was the stripping of the ingrained ideological the ingrained ideology of suppression to come to critical understanding of personhood in the human experience, and the conscientization, in which is an emancipatory pedagogical process, teaching students through critical literacy how to negotiate the world in a thoughtful way to expose and engage the relationship between the oppressor and the oppressed. To me, it spoke to how do I engage successfully with a society that is dangerous, that is hostile, that on a broad scale and over hundreds of years have deemed me as a black man persona non grata. And how he gave me the language and the processes, how to create, again, these processes of humanization. How do now I affirm myself, my personhood, and then conscientization. How do I now engage in critical consciousness to recognize the ways in which ideologically, I had internalized some things that needed to be extrogenic, as he would say, to extroject these ideological frameworks that dehumanize. And so, with that, these two concepts, I began my process of designing or affirming supportive mental health processes for both myself and my peers, myself and my brothers.
I am excited to share my experience of my own mental health journey because that is exactly what it is, journey. And I hope by sharing this, someone would be helped on their own. So, as a Black woman, mental health has been an evolving priority, especially as I've grown to a place in my life that I find myself chasing what it truly means to be healthy, not just in my body, but in my spirit, in my mind, and in my environment. So, as a Black woman raised in the South by baby boomers, mental health wasn't even a topic of discussion around the dinner table or in daily life. Where health and wellness were concerned, you focused on eating right, you focused on going to church to get your spirit right, you focused on exercise, you focused on making sure your attitude was right, but nobody ever talked about what it meant to have your mind right, to have your mind in a healthy space. And so, as I experience things as a Black woman, evolving Black woman in being raised in the South, I remember how particular things would affect me. There are moments as a child, as a teenager, as an emerging young adult, that had a particular effect on my mental well-being. And then I didn't have words to articulate what it was. I used to call it weird. I used to think, oh, I feel out of place. Oh, they treat me like a thing, right? Because as a Black woman in the South, race is one or two boxes, Black or white, and was inconceivable for many, Black and white, that a Black woman could look like me, that a Black woman could have the skin tone that I have, that I could have the hair that I could have, and I would get asked questions and I would get stared at and I would get treated a particular way. And it caused me to present a particular way. It caused me to feel a particular way. It caused me to create boundaries that were stronger than Fort Knox, right? Because I didn't want to risk being objectified. And there was no discussion of it. You just sucked it up and you dealt with it and you moved on and you pressed it down and you kept it in. And as an adult, as someone who has grown and evolved and is now chasing true health, chasing this idea of holistic health, I understand that it was an assault on my mind. It was harmful to me. It objectified me. It caused me to have a very harsh self-inner critic. It caused me to be very cautious of people. It caused me to be, dare I say, even reserved around people because I didn't want to risk having to deal with intrusive questions and stares and trying to figure out where I was from and just a whole litany of things that I endured. But I've come to a place now where I realize that I don't have to deal with that alone because I am seeking mental health wellness in the face of whatever the world throws at me, but not chasing something that someone has imposed on me. I get to dictate my personhood. I get to dictate how I present. I get to dictate on my own terms, and I get to set boundaries that are healthy for me. So as a woman, as a Black woman who is grown and someone who's learning what true health, which absolutely includes mental health, means, I understand those past experiences differently. I understand how people interact with me differently, and I'm able then to respond and exist differently. I understand now through my own journey how being raised in a particular way shaped me for both better and worse. As a Black woman who wrestles with constantly being at the intersection of race and gender, while at the same time constantly having to negotiate my body and my personhood in every space I find myself in. And those spaces include church, they include work, they include 10 years of corporate America experience, they include being ordained clergy as a woman that looks like me, that's shaped like me, that's skin toned like me, who is smart and unapologetic like me. I understand those things differently, and I can now acknowledge them, but not allow them to dictate where I am and how I am. This journey has informed even my education and my training as I answered my call into ordained ministry. So when I applied and I started matriculating through Vanderbilt and Wake Forest in grad school, I made sure I focused on clinical pastoral care and clinical mental health counseling that leads to state licensure, because I understand that as I walk with others in their own spiritual journey and their own mental journey, I want to be sure not to pass on the unintentional harm that was passed on and inflicted upon me on the church, when the church told me just pray about it and suck it up and hold it in, and, whatever that it was. I want to give the people I come in contact with, the people I minister to, space and place, especially women of color, for them to say, I am not okay, and this is wrong, and I feel horrible about it. So whenever I create programming, whenever I develop ministry plans, or even if I'm creating worship resources, I ask myself the question, how is this making whoever uses this better? How will it have a positive effect on their mental, spiritual, and emotional health? And if I can't answer those questions, then I probably should not be doing it. So ultimately, as ordained clergy, as a Black woman working in the church in both congregational and general church ministries, mental health drives everything. It is at the forefront of everything I do when I preach, when I teach, when I mobilize, when I organize, when I plan, when I pray, when I write, and when I do keynotes, when I do workshops. The goal is for whomever is sitting in my audience, whoever uses the resources I may create and publish, to do better and be better for themselves first, and then for the community and their family from which they found themselves in.